Welcome back. A local nonprofit will hold one of its large fundraisers on Monday. The Spine Project will hold its 4th annual Golf for a Vet outing at Royal St. Patrick's in Rydestown. All proceeds go to support this group that provides chiropractic and other health, both physical and mental, care for veterans and their families. The Spine Project began 5 years ago. And this project was founded by Skip and Julie Wiese. They are both doctors, of the Wiese Family Clinic of Chiropractic. They're joining us from a business trip on the road, so we appreciate that. So let me start with you, Skip. This project now began 5 years ago. What was the impetus for this?
The impetus was to get chiropractic care and health care to as many veterans and their families as absolutely possible. We found that, being that Julie and I both are from the 2001 generation of when the attack on 9/11 happened, a lot of our friends were deployed. A lot of our friends actually went into the military because of that attack, and we never had the absolute honor of serving. So the best way for us to give back was to help these vets and their families and active duty military get as much health care as they possibly can without getting backlogged into the VA system. The VA system, even though it provides tremendously great health care, it's backlogged. So we wanted to be able to help these vets and their families get as much care as they possibly can with chiropractic at its core, and different nutritional advice, different exercise advice, things like that, to get them as much care as they possibly can.
So Julie, from that idea and that impetus 5 years ago to now, what's kind of surprised you the most about not only the reception you've received with doing this from veterans, but the rewards maybe you have received from doing this?
It's being able to see the veterans be able to assimilate back into the community better. But this also allows us to not just care for the soldier or the vet, but also their immediate family. Right. So when that soldier is deployed, for them to have the reassurance that their family is taken care of, and to be able to help, yes, chiropractic is the foundation, but the emotional side to it, the cognition, the how we're going to integrate once mom or dad comes back, to be able to allow the child to help with that reassertion back to the family, is to see those stories and those families be able to stick together, not end up in divorce or separation. It really means a lot.
And I would imagine there is a lot of interest in this as it has grown over these 5 years. Demand pretty high. How do you handle new patients, Skip?
Well, we currently have a wait list trying to get in these vets, whether they're moms or dads. We have them on a wait list, and we bring them in as we can. So as the Spine Project can afford to bring on new vets, we do. If we have to bring on their families, we do. Vets hopefully can get pro bono care, which means all of their care covered. Family gets a massively discounted rate, so we can take care of the whole family, and we just keep taking care of the vets as they come in. And as we have a spot open, we bring one more in off the wait list, and it allows us to take care of them for the whole year.
That leads to this question then. How do you make those financials work if you're trying to do it pro bono or at least at discounted rates? Obviously, that's where Monday comes in, right? One of these fundraisers. But the financial end of this, how difficult is it to pull off what you'd like to pull off?
It's hard.
It's not a shortage of veterans and soldiers. It's a shortage of funding. And so that's, again, for us to be able to give back. It's our time, it's our service, it's our resources, but we want to be able to do this in other states. And we have chiropractors and we have facilities that are set up to be able to do this. Okay. But it honestly comes down to funding. And, if it's a monthly, agreement to be able to sponsor a veteran, that is ultimately what we're looking for in our golf outing.
All right, so that awareness as it grows among the veteran communities, what you need is for it to grow among the community itself, the donating community. Interesting point you brought up there, Julie, so let me follow up on that with you, Skip. I asked how this has grown in 5 years. Where do you see it 5 years from now?
5 years from now, we'd like to have it in 25 states, and within 10 years, we'd like to have it in all 50 states, so we can start seeing as many vets nationwide as we possibly can. Let's just be honest, with the turmoil and what's going on in this world, there's going to be another deployment. We're going to be in another conflict at some point, both either home or abroad, and these guys are going to need care, and these men and women are going to need care when they come back. So to get it in as many states as possible is absolutely what we need to do. And in the best circumstances, I would love to have all of their care, including their families, covered at no cost because of the services and sacrifices that they give on a daily basis, and some have paid with their lives. We owe them this to get them the best health care possible. And it takes a lot for me not to get shook up because these vets, they mean everything to us. And without what they've been able to do for us, we wouldn't have the life that we have in the United States without the vets that have been around for 2 centuries.
Well, Julie and Skip, we thank you for the time. We thank you for what you're doing. Good luck on this project. It is worthwhile for sure, and good luck on Monday.
Thank you so much for having us on.